Whenever required or whenever you are asked to, please do unmute yourself. But otherwise, always use the chat box so that I know that I am not dealing with a robot. Like how in certain web pages they show tick if you are not a robot, something like that. So do use the chat box as much as possible. I'll just share my screen just a second. So is the screen visible for everyone? Yes, I still need thumbs ups so that I know. Even if you don't drink the cold drink of thumbs up, this is a good place where you can show your thumbs up. Yes, is it visible? There are 47 participants. Right. So let's delve into the topic. What do you observe in this image which is being shown on the screen? I want you all to use the chat box. Please use the chat box and actively comment on what is it that you are able to observe on the screen in the image which is being shown right now. I have got a lot of patience, so I won't be proceeding before I start getting answers. Yes, Rinzi, stress and depression. Rinzi is the only one who has been actively participating since the beginning. I can see that. Requesting everybody to turn on your cameras as well as to start becoming active. Yes, Geeta Nair says sad, stress and storm inside, distorted mind, depressed. Yes, more answers. Only 4 people, only 4 participants. I think we should make it a rule that people who don't respond to the chat box should not be given attendance, like how we do in schools and colleges. Yes, more response. Yes, disturbed. There are a lot of thoughts going on, but on the surface, it's like mild expressions. Yes, unable to express what is going on within a person. Depressed and in a difficult situation, agony, depressed, anxious, there's a storm in the mind, stress, pain, tears, depression, exactly. Hopeless, yes, wonderful. Thank you for the responses. Yes, Jayanta, it's a clouded mind. Depressed, Manju Singh, yes. So as you can see here, there is a storm going on inside this person's mind. You can see there is a fire, there is a storm, there is rain, everything is happening. And at the same time, you can see the soil. What do you see from the soil? It's a dry, parched soil, right? Not enough for life to survive. This is all being manifested outside just as a teardrop. And I want you all to know that this is the situation in which many of our patients, if not all, come to us with, because they have been recently diagnosed with something which we call as a life limiting illness. It is going to limit their lives either in quality, very often in quality, almost always in quality, and many a times even in quantity. So with that, we'll start our topic for the day, which is pain and its impact. So what is health? Yes. Can we all get active on the chat box again? I want some quick answers. What does health mean to you? Many of us are already in the health sphere, working since many years. Something which we take for granted that we know. Can we revisit it? All the people who are in horizontal positions already also, I can see in some of the videos. Okay, absence of disease. Health. physical, mental, and emotional well-being, physical and mental well-being, a person who is physical, mental, and emotionally balanced, social, mental, and physical well-being, overall well-being, right? So we have brought in all dimensions over here. Health is the state of total physical, mental, and social well-being. Let me ask you another question now, a follow-up question. Everybody, almost everybody has responded with different dimensions. Now tell me, when you go to a doctor, which is the dimension which most often gets addressed? Physical, 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 physical. Yes, a lot of physicals are coming in. But physical is only one of the dimensions, right? Out of the four basic dimensions which we can call in a human being, physical, social, psychological, and spiritual, only one dimension, that is 25%, is what is being addressed. What about the remaining areas? What happens outside the four walls of an outpatient department or an operation theater is something which we conveniently ignore many a times, and that is something which needs to be addressed. And this is one thing which palliative care is trying to do in a systematic manner. So, as all of you have said, a state of complete physical, mental, and social well being, and it is not merely the absence of a disease or infirmity. Right, let's proceed now. Here, I want you to introduce to a true life story, which he was a beneficiary of Pallium India. He was. He was diagnosed with a type of head and neck cancer. This is a real image which was taken. He was sitting with a lot of pain over the head and neck region, emotionally distressed as well. So, for confidentiality, we'll call him as Mr. A. He was diagnosed with a kind of head and neck cancer. He was on disease modifying treatment from the cancer center, active treatment going on to try to stop the disease from progressing. He has a wife and three children, and he has an elderly mother at home. Now, when a person is started on treatment, I want you to know, an illiterate person going to a tertiary care hospital doesn't know where to go, where to reach. Most of the time, they reach early morning, there'll be long queues, they skip their meals, and they'll be in the hospital throughout the day. In between this, their caregivers are also there. To reach the hospital also, many of them undergo a lot of difficulty. Well-to-do people have options, but majority of the patients belong to lower socioeconomic strata. When people come from that sort of a background, they depend on the public transport. And you can imagine, whichever city you are in, how comfortable traveling in public transport will be, right? Just imagine a person who is having severe pain, having to go to hospital, sitting in a public transport, either a bus or a train, for a few hours, 2 times in a day. If they have to take a cab, then they have to look at affordability. Many of them, like many of our beneficiaries, are daily earners. Whatever work they do, they earn on a daily basis. So if they have to come to the hospital, that day there is no income. So these are all a lot of practical issues which a patient has to face. So, like we were saying, that there is a physical, psychological, socio-economic, as well as a spiritual dimension to every person. And when you address all these four dimensions in a person, which is what the effort of all healthcare is supposed to be, that is when we call it as total pain. And we have to address this total pain. Hence, illness is not just suffering, which is much more than physical distress. Illness related suffering is much more than just physical distress. Just imagine what all are the thoughts which Mr. A was going through. Yes, can we come back to the chat box? Come back to the chat box and tell me what may be the thoughts, or put yourself in a position when there is an illness. What may be the thoughts which will go through? Do imagine that this may be an illness which is potentially not treatable. People are going to recommend all kinds of treatments, and affordability may become an issue. You still have a family to take care of. You may be the only breadwinner of the family. What are the thoughts which may be going through the mind of such a person? Simple question. Let's put ourselves in the shoes of the patient. Feeling burdensome, money, financial problems, fear of death and uncertainty, stressful. How the family will survive after me? Yes, Anukriti. Uncertainty, out of pocket expenditure of money which happens. Depression, how to manage finances, stressed out, fear of death and family is left. How will I manage everything? Yes, Dr. Anu, very true. How will I manage everything? He has been the sole breadwinner of the family. How am I going to get rid of this pain in my body and mind? Fear of leaving loved ones, depression, fear of death. Yes, yes, yes. Wonderful. So these are all thoughts which we are going through Mr. A's mind. Let's look at them. Will I be able to pay my medical bills? How will I provide for my family? I don't want to eat or talk. In such situations, many family members, relatives, or friends may come and say, "Don't worry, everything will be all right." They may not be in a position to hear that because they know their life is at stake. There is too much pain. He is unable to sleep because of the pain. This particular person, he had not slept for months because of the pain which was there. And for people in the medical background, they know that the head and neck is a region which is heavily innervated by nerves. There are a lot of rich supply of nerves. More nerves means more pain. So severely painful conditions is what head and neck cancers usually are in. Am I going to die now? These are all questions which you all have told already. And these are all real questions which was there in this person's mind as well. Pain and depression coexist and many a times co-exacerbate. Let's suppose you had a very stressful day at work. All right. You had a very stressful day at work. You got a headache. You have come back at home in the evening. And then there is nobody at home to give you a cup of tea. Your spouse comes home late from office. And now you know that you have to take care of everything. You have to cook, you have to clean the house, you have to take care of the kids. So all in all, what is going to happen to your headache? Come to the chat box. Is your headache going to increase or decrease in such a situation? Yes, chat boxes, please. All right. It will increase. One person says that they may forget about the headache. Yes, that's what happens to most of the people in family situations. You have to forget your own headache and take care of others. But usually this is going to increase manyfold, right? So do understand that psychosocial issues, psychological issues, physical symptoms can increase and decrease based on the ambience or on the environment where the person is existing in. So pain and depression as well do coexist. Also remember that less than 4% have access to pain relief in India. How many of us, even those who went to medical school, were actually taught when to use paracetamol, when to use a NSAID, when to use morphine? This was not taught in a structured manner. And this is a reality which we face in our palliative care circles every day. See, this person has been going in and out of the cancer center for months. But because of the severe pain, he has not slept a single night. And we gave him something called as a morphine trial. We'll come to it later. And that is when, after many months, he was able to get one night's sleep. So that's an unfortunate reality of a person who is having a severe illness, but not being managed, the symptoms not being managed well. Hence, patients who are in pain or patients who have life limiting illnesses, there should be a psychological evaluation as a standard practice. What is happening in that person's life apart from the disease. Remember that one P is the patient, but there is a bigger P, which is the person. Right? He was a person before he became a patient. So always we need to look at to understanding the person more. So that's about pain and depression. Emotional issues, of course, 1 in 2. This is a study which was done elsewhere. So 1 in 2 patients, cancer patients, are significantly distressed. No doubt about it. Many of you would have heard somebody responded out of pocket expenditure. India is a country where it has been in 2018 or 17 or 18, there was a report, a scientific report which was published in British Medical Journal, in which it is said that 55 million Indians were pushed below poverty line. Okay, 55 million people pushed below poverty line because of out-of-pocket expenditure. How many of us have healthcare over here? We don't have, healthcare insurance. I see many of the people, even in healthcare circles, don't have healthcare insurance. So when such a situation arises, and mind you, any one of us can be in that situation tomorrow. When such a situation arises, whatever is the money which has been hard earned over the years is going to go. It's going to go very, very quickly. So emotional and psychological issues are there, and patient gets easily distressed due to many, many reasons. Mental health is also affected. So there is a whole lot of issues which comes out when a person is in health related suffering. I want you to glance through the words which are there in the screen right now. There's a lot of mental health issues which happens, psychological issues, emotionals. People may go into drugs, suicidal tendencies for self-harm, post-traumatic stress, unhappiness, not feeling like eating and drinking, leading to anorexia. They need therapy. They need to have awareness. All these things, you may not be able to explain everything to a person whose IQ is not high enough. So there are so many issues which a person is such a complex amalgamation of so many issues. And this is what healthcare is supposed to address. But like you said, whenever we get an illness, we go to the hospital, and the only and only dimension which usually gets addressed is the physical dimension of that person. So psychiatric disorders have shown to affect at least 30 to 35% of cancer patients. So it is a big burden on cancer patients. I have used only cancer as an example right now, but I want you to know that only a small number or proportion of patients in the palliative care circle are cancer patients, even though it seems like a huge chunk by itself. But I also want you to remember that there are so many, many patients who are having neurological disorders, children having congenital issues, people with kidney disorders, unable to go for dialysis, not getting a transplant, cardiac issues, etc. So there are nearly 20 to 22 conditions which comes under the definition of life-limiting illnesses. Two of the infective causes or infective diseases which warrant palliative care is HIV, AIDS, and tuberculosis, which in itself has got a lot of stigma associated with the disease, very poor prognosis in many situations, a lot of drug related side effects. So there are so many other diseases apart from cancer as well. And you can imagine, if a person has a stroke, is there anybody in this audience right now? The number has risen from 47 to 69. Is there anybody in the audience right now in whose family there is a person with stroke and who has become disabled? I would look at the chat box right now. Is there anybody? Yes, yes, yes. Right, somebody's father, somebody's grandmother. So I'm sure you know the difficulties which the family goes through when a person becomes disabled. Till today, the person was able to eat his own food, was able to do his own day-to-day course, like taking care of themselves, bathing, going to the toilet, stepping out of the house to get some fresh air. So when all these situations happen, and tomorrow onwards the person is not able to do that by himself, just imagine the loss of dignity in that person. I certainly don't want anybody to come and clean me up, even if I get disabled tomorrow. It's not going to be easy for me to accept that. So when a person is put into that situation, helplessness, the person becomes completely helpless. And in such a situation, imagine the burden which the family has to go through also. I'm not saying burden as a negative connotation, but just that they have to take care of each and every aspect of somebody else's life as well. And after some time, there is something called as compassion fatigue. That is, you are compassionate towards somebody. One day you are compassionate, 1 week you are compassionate, 1 year you are compassionate. And then suddenly you will realize that there is no time for yourself. There is no time to take care of yourself. And when that happens, there is a frustration which starts occurring. The caregiver's mental health also starts getting affected. And it is the objective of palliative care to address the suffering, the concerns of the caregiver as well, not just of the patient. So also remember that in people who are depressed due to the disease condition which they already have, they will not be feeling like taking medications properly, eating food properly, talking with people properly, and all these situations leads to poorer treatment outcomes. I'm seeing some comments. Mr. Shivakumar, sorry to hear that you had recently lost your father. My father was at 83 years, used to get irritated when I gave him bed bath, changing diapers, feeding him, etc. Absolutely, especially for a person who is elderly, who throughout their lives have lived independently, who have their likes and dislikes. It's extremely difficult to contribute positively. And many a times we go through, the family members also take the brunt of it. Now here, already we spoke about this high financial burden, right? So when there is high financial burden, there is lower health related quality of life, because many a times, if there is out of pocket, if you don't have an insurance, if there is out of pocket expenditure, the more money you have, the better treatment and healthcare services you can avail to. But usually that is not the case. I'm coming from a public health background, and me coming from a public health background, I can tell you that even today in India, over 65% of the people reside in rural areas, and over 65% of the people are still below poverty line. Now, when that is the situation, I want you to imagine the financial burden due to health related expenses which can happen. Certainly, accessibility to centers of excellence, tertiary health centers, is very poor. I'm sure many of you are from the medical background. people who are in government hospitals. I'm not sure if how many of our participants today are there. If there is some doctor, it would be nice if you could respond on the chat box. Just look at the population, the number of people who go to a hospital in a government setting. I have seen wards in which on the bed there is one patient and below the bed there are two patients who are admitted because there isn't enough infrastructure. Now, on one side, we are talking about Ayushman Bharat scheme and all those things are there. There are a lot of technicalities to it as well. There is a limited amount of money which is also available for each hospital. So, this is the ground reality where we have overpopulation, an overburdened health system, and people who don't have money to spend. So there is a low health related quality of life, which of course leads to poor mental health. And this leads to something called as non-specific psychological distress. You're always in a distress. It's just like saying somebody who is going through a difficult situation in life, they may be able to function. Day-to-day responsibilities they may have to fulfill, because if they don't fulfill, there will be consequences. Their family members may get angry on them, or their in-laws may badmouth them, their boss may fire them. So many issues are there. So they have to address all these issues, responsibilities in life. But there is a background sadness. Remember the first image which I showed you. There is always a background sadness which is going on, a psychological, non-specific, distressed situation which a person is going through inside. Right? Now coming to death. Very much in our palliative care world, death is a reality for everyone. But it is a subject which we have to closely deal with when we are in palliative care. But it is not the death, it is not death or pain that is to be feared, but the fear of pain or death. Shiv Kumar sir said now that he was depressed through his father was depressed towards the very end, he was very depressed. There was no geriatric healthcare centers. Though he's a consultant in a hospital, he couldn't do much for his own father. And I'm sure his father would have gone through a lot of uncertainty, pain, suffering. And all this leads to a fear of what is going to happen next. And this is exactly where we need to handhold a person, where we need to sometimes talk to them, but many a times just be there for them. It is not always that words can heal, not always that actions can help. Sometimes we just have to be there quietly, sitting with them. Do remember that incidence of suicides in people with health related suffering is pretty high. And this happens this highest in the first 6 months. This is why it becomes important that anytime such a diagnosis is made or such symptoms start and such a diagnosis is made, which brings in helplessness, hopelessness, worthlessness, and uncertainty in a person's life, we really need to be there with them for the first 6 months, because it is during these 6 months that the person's psychological realities starts taking shape. If they are fearful, we have to do things to allay the fear, to reduce the fear. Otherwise, it is possible that after these 6 months, no matter what you do, it may become difficult. It may become difficult for them to come back to a baseline normally functionable state. So this becomes very important. Coming to Mr. A's wife, she also underwent a lot of uncertainty. She underwent depression. This is from a study which showed that nearly 40% of caregivers of people with serious life-limiting illnesses show clinical depression. Okay. And higher the distress, there is increasing premature morbidity and mortality. You just cannot live a stressed out life. Now there is a lot of science evidence which has been generated which says that stress leads to a state of chronic inflammation in your body. And if there is chronic inflammation, it will lead to disease states, it will lead to premature diseases as well as death, premature death. So let's come to what had we done for Mr. A's family. How did we address this as a whole? Basically, how did we make total pain into total care? So something called as an opioid trial was given. So we, in palliative care world, and now it is part of the medical curriculum as well, there is a stepwise escalation of pain medications which we can give for a person who is having physical pain. Now, when Mr. A came, he was in severe pain, unable to sleep, not slept since many days. So we did something called as a opioid trial or a morphine trial. So when this morphine trial was given, within half an hour, the pain score from 10 out of 10 became 0 out of 10. I am telling absolute pain relief. Just imagine how stupefied that person must have felt that one doctor is able to take away all my pain, but I'm going to a specialist since many months and nobody was able to do this. Why is a question which we should ask. Every doctor should ask himself, or every medical person should ask. Because tomorrow it may be we ourselves or somebody who is a near and dear one to us who may be in this position. So from that day onwards, we started this person on morphine. We arranged a psychiatric consultation for both of them. Now, we needed to look at some rehabilitation for them through which an earning can happen. So there was a volunteer network, a group of good willing individuals from society who want to contribute back to society. So we had a volunteer-led sponsoring of education of the children, and poultry business was set up for his wife. I want you to know that there have been situations when we have kept on increasing the dosage of medicine. We kept increasing the dosage of medicine, but nobody was able to understand why the pain was not getting relieved. Then we asked him, can you tell us what is bothering you the most? He's going to die in a couple of weeks or months. And he said that my children's education, I may not be able to go to work. My wife may not earn enough. How is it that my children's education can continue? So this is where we realize that there are, if so we got into a volunteer network, appraised them of the situation, and they were able to sponsor that child. And after the social dimension or the economic dimension was taken care of, you would be surprised to know that the pain reduced and we were able to even bring down the dosage of morphine. So that is the impact which it can have. And here we helped the wife set up a poultry business as well. And spiritually, the family felt dignified that they can earn their own living instead of being always, sort of on the receiving end from people. And they were able to give back to society in some way. The eggs which was coming out of the poultry business, they were selling it to a local market and earning a living as well. So what are our conclusions? There is a high prevalence of mental health issues, not only in cancer patients, but in patients with all kinds of chronic illnesses, life-limiting illnesses. Second is, always we need to have a multidisciplinary approach. A doctor may not be able to solve all problems. Gone are the days when doctor used to get involved with all issues. Once upon a time, it's a very cliche thing to say that doctors were looked at as gods. Once upon a time, they used to get involved with family activities. If there is a marriage in the house, even whom to marry was a something the doctor used to get involved with, but gone are those days. We have to come back to our realities right now. Everything has become very compartmentalized. There is a doctor who may not get the time to explore all parts, I mean all the dimensions of a person. Hence a multidisciplinary approach is always very important. A doctor may only see the person for 10 minutes. A nurse may only see the patient for 10 hours. A social officer or a social worker may be able to visit the person few times. There may be a community volunteer who is a neighbor of the person, who is able to understand what is going on inside the person's house day in and day out. So all these inputs are required to understand what a person is going through. And only once we understand what a person is going through, can we try finding solutions for that person. Always remember the approach of total care. That is addressing the various dimensions which a person can, person has and can be addressed. Remember that always you may not be able to do everything about a situation. But even if you take the effort to ask how they are doing, what are the other issues which they are facing, even that venting out which may come out of it will make the person feel good. Yes, all of us have that one friend or our spouse or our partner or whoever it is, where we have the freedom to vent a little, and that makes us feel much better. Same way, do know that for a patient, they may not be able to bring out their concerns or uncertainties, all of it, to their own family members. What will family members say the moment a person says, I'm very scared about death, I'm not sure if we'll be able to do this or not? What will the family members say? Don't worry, we'll see. Why you're thinking negative? Immediately all the gyan starts coming. And gyan is the last thing which a person in such a situation needs. Lastly, always remember that it's not always possible that a patient may be able to reach out to a hospital or a healthcare facility. And hence, we need to have a mechanism immediately in their community, around them, accessible, affordable. And that is where volunteer involvement comes in. Our country is soon going to become an elderly nation. In the sense, the proportion of people who are above 60 is going to rise. Many of us are headed towards that direction. And when that starts happening, there is always a lot of good-willing people who want to give back to society. And identifying those people, developing that something called as social capital, so that people within their own community who need support, it may be support financially, emotionally, against loneliness, against different situations which they may have to face. It may be a retired lawyer who may be able to advise regarding legal aspects. It may be a retired insurance agent who may be able to give information about how to get a health insurance. All kinds of people are relevant to ensure that there is a network, or there is a support system within the community. Within the house also, what can be done may be limited. But if the larger community comes into picture, I'm sure a lot can be done. It is just like that old saying goes, if you have one twig, it's easy to break it. If you have many twigs come together, it's not easy to break it. It strengthens up. Just like that, a person's situation can be addressed if there is volunteer involvement as well. So with that, here we have a picture where you can see our founder in the center. On the left side, the small man over there. who has taken up the giant responsibility of pioneering palliative care in the country, Dr. M.R. Rajagopal, with our nurse in the front and volunteers walking towards a patient's house through a hilly terrain. So this is what we specialize in: home-based palliative care in a multidisciplinary way. So I'm sure we'll be learning more about this over the coming sessions. So meanwhile, I'll pause for any doubts, comments, thoughts before we move ahead. Please become active on the chat box. If there is something anybody wishes to share, please raise your hand so that we can ask you to unmute yourself and speak up. Or if anybody wants to directly unmute and speak up, please do. Shivkumar sir, I'll be glad if you could unmute yourself and share your experience of pain and its impact, which you have gone through. Meanwhile, others, please do feel free to use the chat box or unmute yourself and share. All right, so sir is having some network issues. All right. So Ashwati Vijay is asking, how can we help the families with financial constraints? How can we contact these volunteers? See, one of the things is what we are striving to do is that there are a lot of government mechanisms in place. There are a lot of government schemes. Health is basically a state subject. So depending upon different states, there are different government schemes. There is schemes for financial assistance, treatment assistance, insurance assistance, all kinds of schemes are there. But hardly anybody knows about it. I want you all to know, in medical school also, there is only one subject which partially deals with it. Other than that, all the others doctors passing out have no clue about what are the schemes. Till the time they start working in the government sector or in the social sector, like we are doing over here. Now, when that is one element, Ashwati ji. Then we have to bring in the network or collaborations with other NGOs. There are a lot of NGOs. There are lakhs of NGOs in the country, non-governmental organizations. The objectives of NGOs is usually something to do with the social realities of a person who is undergoing issues. And different NGOs have their different objectives. Identifying these NGOs in your community. Community means it may be your ward, it may be your block, it may be your district, it may be your town, it may be your state. It depends. But basically searching for those people or those organizations which support such people. And other thing is well-meaning individuals. If you are staying in a building, I'm sure there is a residents association. Even if you have an independent house, there will be a local residents association. The monthly meetings which the residents association has, that is a perfect platform for you to say that we have people with suffering in our society. Why don't we come together and see what is it that we can do? It is not always necessary that only the money has to be given, Ashwati ji. It can be cash or kind. For example, when a person says that they are not having enough money to afford food, if there is a well-meaning neighbor, or there are few neighbors, or there is a network of people around, easily one family can take up one time's breakfast, one family can take up lunch, one family can take up dinner. It's only a question of coordinating all these things. The willingness is always there, but we think it is impractical probably. So the effort has to be put from our end to make sure that We sensitize people to the issues which is existing in society and make mechanisms to make sure that they themselves are willing to contribute. And we don't want to make it too burdensome for any one volunteer. If there are 5 volunteers, those 5 will be doing different tasks related to the patient. So that way it can be taken forward. Yes, Jayanta ji, standing besides at the time of distress makes a lot of difference. Many a times, there is nothing which we can do. We are absolutely powerless. We may not have money to give, we may not have words to speak, but just standing beside them, maybe keeping our hand over their hand, maybe just hugging them, not just sitting beside them. All of this can make a huge difference for a person. Yes, Shivkumar sir is saying that geriatric care is badly affected and neglected. Absolutely. Me being in Kerala is especially a cause of concern. Um, Supposedly, Kerala is going to be one of the first states where geriatric population is going to hit a huge proportion. And as many of you know, a lot of the Malayalis are in the Gulf countries or somewhere abroad. Their elderly ones are alone. They don't have support. So geriatric care definitely is badly affected and neglected, and there is a lot of work which is being done as well. But certainly with the population which we have, which is 1.6 billion people, which is a very huge number, I am sure that there is always something more to do. A trauma a family has to undergo after the death of an elderly person in the family is worse than the pain itself. I was a COVID warrior and I have seen more deaths, close to 600. I too got emotional and became a total nervous wreck. Yes, very much a reality. I remember the COVID pandemic times as well when we were posted in hospitals, and my department over there was in Karnataka. We were handling a COVID care center of 600 rooms with each room having 2 people. So self-care is something which is also prioritized in the palliative care circle. I must confess this to the whole team here that palliative care is one of those specialties having highest burnout rates, because how much suffering can you see and how much suffering can you keep listening to? But we have come to a stage where we realize there is so much we can do. You need not suffer along with the patient, because I don't want your energy to go in the suffering. I want your energy to come towards making solutions for a person. And there is always something to feel good about. You know, if you are not there intervening in a person's life, he may have had a much more miserable ending or miserable quality of life. But because of your intervention, things became a little bit more bearable for the person. So, yes, bereavement support is another area which we look at, where if a person has passed away, we make a specific visit to the family and then we ask them, how are things going? Is there anything which we can support with? What is the psychosocial issues happening in the family after the person's death? And see the support which we can give. So these are all the realities which we are trying to address in the palliative care. Is there something else which anybody wants to share? Is everybody able to follow? Can you please come on the chat box? Do you want me to slow down, fast up? I mean, increase my speed, or do you have any doubts? Anything? I'm going to pause here so that you can respond. After I get a good number of responses, then we'll proceed. It's unfortunate that despite of so many requests, only so few of you have turned on your videos. I'm not even able to understand what you're doing. If you're part of the discussion which is going on, or if you're just switched on the camera and you're doing something else. Yes. Can I have some responses on the chat box? Can we proceed? Is everyone able to follow? Chat boxes, please. So I think next we will go on to a sample. Is this a sample? This is a case presentation. Yes. So we will be having a case presentation every single day. This is also to engage you more actively and for us to get some hands-on experience regarding what are those elements which needs to be looked into in a structured manner when we are trying to address palliative care for a person with serious health related suffering. Devika, over to you.
Thank you. So here we have a case presentation of one of the patients in Palim, India. So as you can see, there was a patient of 7-year-old male with cerebral palsy, hypothyroidism, seizure disorder. So coming to the medical history, his diagnosis, as we mentioned earlier, since birth the patient is suffering from illness. You can see during the birth what were the symptoms that he had. Early interventions took place and somehow the physiotherapy could help him to have a slight changes as reported by the informant. So the informant were his aunt and father. So he was completely bedbound. He used to take food intake. He takes 2 to 3 hours to feed, and he weighs only 6.5 kg, and is currently on treatment from SCT Trivandrum. It's a hospital in Trivandrum which treats for the pediatric, especially the children. So let's move on to the insight. So coming to diagnosis, the patient, obviously the kid, regarding diagnosis, prognosis, and palliative care, it was not able to assess as it is a helpline patient and the age as well as the disability. So coming to family, they knows about the illness through the doctors. Regarding prognosis, all the family members expect the child's mother knows and accept the prognosis. The child's mother believed in a chance of recovery, so she had a hope of recovery. Regarding palliative care, they were aware about that it is a care for bedridden patients. So this was the whole thing that they knew about palliative care was it is only for bedridden patients. Now, I think we've already had a session of psychosocial assessment previously where Smriti ma'am has taken how to go with the genogram. So this is a sample of the genogram of this patient. So as you can see in this genogram, there are more number of patients. So there are more number of patients, especially the kids' grandparents. You can see both the fathers and mothers, grandparents, 4 of them are patients. And you can identify who's our patient. We have put an arrow mark towards the P, so the letter P. So coming back to the children, as you can see, the children, their siblings, the patient siblings. The first one, they had a miscarriage, and the second one is a son of 13-year-old, and then a daughter of 10-year-old, and the patient is a youngest child. So let's say Mr. K, child's father, has a stressful relationship with his siblings except the younger sister. So he's only having a good rapport, a good relation with the younger sister. And he's having conflict. He's not in a good, having a good relationship with the other siblings. Due to that, he had to build a house in the ancestral property by taking a loan. So even though the extended family would inquire about the status of the child, so his father managed to get a visa to work in the UAE, but he couldn't continue his job as his wife developed psychological disturbances as a result of his absence, as well as dealing the illness of the child by herself alone. So as you can see, what is the whole family is going through from this. As reported by the informant, she talks to herself. So hears strange voices. We have auditory hallucinations and we have visual hallucinations. So she was clearly going through auditory hallucination where she listens, where she can hear things. And she also has poor sleeping pattern, sad mood, and is not performing well in household activities as well as in taking care of other two kids. The elder child in the family is about 12 years of age and he's trying hard to help his mother in taking care of his brother. So the middle child is 10-year-old. She doesn't know how to take care of the struggle she's going through. Grandparents are getting old age pension and this is the sole income of the family. However, the father is trying to move for a permanent job and he has some hope in future. So let's see the echo map from where they get the resources and other assistance and help. So let's go with the extended family first. The patient and his family is having a really stressful relationship with an extended family. So it clearly shows that they're not getting really good help from their family. And regarding the siblings and patient's fathers, friends, and from SAT, they're getting a positive help. So it means that three of these areas is giving help and assistance to the patient and the family. However, there is a very weak relationship, or they get a very weak, meager help from, they're having a very weak status of their religion, as you can see. Now, regarding Aunt E, where we've already discussed about Aunt E is a one person the patient's father is having a rapport, the only good relationship that he maintains. So as you can see here, they're having a very strong relationship. So one strong relationship and the help that this patient and the family gets is from Aunt E. Now, let's move on to the socio-economic overview. So they live in a partially completed 2 BHK terrace house. So they've taken a loan from private bank for building a house was necessary for them. Also, the hope that the father could continue his job in Gulf to repay it. And the primary and sole breadwinner is his father by doing coolie job. And their ration card is BPL, below poverty line of pink color, and thus they get rice from there. But other food needs like baby food, since they're having baby food, grains, vegetables, etc., are not met. So the grandparents are getting old age pension, no financial support from anyone near and dear to them. Father was in Gulf for an year, but he quit his job due to the illness of his child and now occasionally doing coolie job for daily wages. Other ill members of the family are not taking proper treatment for their illness due to the financial crisis. So the treatment expenses are high, especially the medicine that are not available in SAT, cost around rupees 4,500 a month. So educational expenses of other siblings are getting higher. So when coming back to psychological overview, psychological assessment of the patient was not possible as the case registered through helpline. According to the family, he only opens his mouth and lip movement shows that he is hungry. That's only information that we could get since it was a helpline registration. Now, so I think Dr. Deepak has already, explained about the total pain. So when we take this particular case, what are the possible physical concerns that comes? Movement, completely bedridden, ADL impact, cognitive impairment, life-threatening disease, multi-organ dysfunction, and there are many more. Coming to psychological behavioral issues, irritability and crying spells, deprived mother psychological well-being, which is very important to be addressed. Coming to socioeconomic, separated from other family members, neglected parenting, acceptance of the society is low, they're having financial crisis, there's unemployment when taking the patient's father's current condition, is not able to complete his loan, and he is in the middle of chaos and thinking how he could help his children to continue the education and also how he could move forward with the treatment and other ill members in the family. As you can see, 4 of the grandparents are having illness. So how to take care of that, how to provide treatment for them. Now coming to spiritual, as I have showed that they are very weak and meager relation with the religion. So it clearly shows that they've declined the faith in life. Probably they had faith before, but right now they're going through the whole physical, psychological, socio-economic problems, and they now think that they don't have they have no more faith in life, no support from religion, future hope. So they would be thinking, what is going to be the future? Now, so after all this case discussion, these are some of the discussion points that we can take. Family's primary concern is the survival of the patient. So the primary concern would be the survival, whether how long, about the prognosis. So not everyone knows about the prognosis and how far it is possible. And the second most important is mother psychological recovery or well-being to support the patient. So the mother is the only person who's always there at home taking care of the children. So she is the one strong person that needs to be with the patient and rest of the children. But she is going through a severe psychological issues due to financial crisis, due to the physical condition of the patient. Now, the meeting financial expenses. So the father would be going through how to continue the education, how to repay the loan. Also, the baby needs diaper, 4 to 6 diapers a day. Need to buy that food, no sufficient food apart from rice for the family. Then psychosocial supports for the family, social support, occupation, extended family support, coping skills, interest, abilities. So the patient depends only on baby food since he is 7 year old. The food we cannot give him the adult food. We have to go for the baby foods, feeding issues, anything else could cater the need. Vocational rehabilitation for the mother or anyone else in the family, how far we'll give. Now, what is the quality of life of the patient? So let's go for the plan. So in this case, as we discussed, this comes in a helpline registration. So we haven't seen the patient in person. So these are the information that we have collected over phone call. So now our plan would be to do a home visit to explore more about the psychosocial realms, then to provide education support for the children. So from this, we could understand a lot of things. So let me just ask few of you. So what can be so what do you think can be the support that we can give in terms of supporting the mother and in terms of supporting the whole family? I would like to get some responses. What do you think are the different ways that we can actually provide or how to go with this? Since this is a helpline registration, which we could get all the information over a phone call, what is the rest of the plan that we could do? The rest of the intervention that we can plan for? You can use your chat box also.
Yeah, please feel free to unmute yourself. I have seen Narayanan sir has unmuted himself. Sir, would you like to say some comments?
Yeah, I'm not able to see myself. Just a moment.
Yeah, sure, sir.
Yeah. Am I visible anyway?
Yes, sir. Yeah, visible and audible also.
Okay, mothers, to help the mother get support, either emotional support or physical support, link her up with an NGO which is focusing on mother and child care. Like you have women short stay home or NGOs that work with women focus. So identify a resource agency nearby where there preferably will have a social worker who would physically come and be of support to understand the situation and draw up a plan of action for the mother. For the economic issues, like vocational rehab for mother, anyone else through that NGO. For baby foods, we have to tap into either same NGO or other NGOs which have focus of child welfare activities. These are the two things that comes to my mind topmost as critical issues.
Thank you, sir. Good. So let's move on with this
Chat box also. I think there are few chats. Can you
go
just
back over.
come back to the slide? Yeah. Can you open the chat box also? Yeah. So yes, contact NGOs for the day. I think I gave that idea away. Yes, but that's correct. We need to contact NGOs. come up a little bit. Mother needs psychological treatment. Children needs education support. Vishwanathan sir from Palakkad is saying we can help to arrange for supplies of food and diapers. Yes, I'm sure there are a lot of well-meaning individuals who would wish to support the situation. All said and done, it is a race against time. We must have a quick TAT to address these issues. TAT is Shivkumar sir, if you could elaborate. TAT. Nibedita meanwhile says mother needs emotional support. A spiritual boost could be helpful as well. Turnaround time. Yes, sir. Turnaround time. So one important point which Prince Thomas has brought out is spiritual boost. This is also one area which we should remember, that the Indian culture is very strongly interweaved with religious beliefs, cultural ethos, spiritual, belief systems, and this is an area which can bring in a lot of support and solace. I'm not just talking in terms of the psychological support, but also the socio-economic support which can come in. I want to give you a real life example as well. Recently, I had been to Kashmir, and over there we had visited a palliative care facility. This palliative care facility is working in collaboration with another NGO to provide palliative care. This another NGO is specializes in cancer, so it is called as Cancer Society of Kashmir. Is there anybody from Kashmir here in this batch? If yes, please do mention on the chat box. So during the holy month of Ramzan, you will not believe, just through the community around this place, they were able to raise rupees 4 crore in that month, in that holy month. That is the amount of money which they were able to raise, and which they are going to use to set up a full-fledged palliative care and cancer support wing. So I'm saying that what is possible, things are possible if we are willing to put effort. We don't need to, think always conservatively. Sometimes we have to start thinking little out of the box, and realizing the strengths of our community, of our religious systems and everything. I'm sure that there are a lot of things which we can do to build that infrastructure of support which this mother would need, the education support which this child would need, a job which the father can get somewhere else. So many things are possible. Yes, Devika.
Yes. So I also would like to get some response of how are we going to discuss about the primary concern of the survival of patient, since regarding the prognosis. So how far it is possible? What do you think? I would like to get some responses on that.
Can you open the chat box? If somebody wants to unmute, please do. Can you put the chat box on the screen? Yeah. So yes, as Vishwanathan sir is saying, supply of prasadams in a community where that is acceptable is also one of the ways which can make a difference to show community support, boost moral confidence. Yes, it is true. See, this all depends on what you can think of at a local level. From culture to culture and from state to state, what are the things which you can do may vary. But the sky is the limit. You can go to whatever extent to see what we can do. So Shivakumar sir says, I am now with Rotary International, where I am the chairman of the Rotary Foundation. Fantastic. I'm sure that itself brings in a lot of resource, which was asked earlier about the Kerala model of palliative care. And if we can mention a little bit more about it. Shivkumar sir, can you please tell me which city are you based at right now? Open it. This thing. Yeah. So Bangalore. See, this is basically what I'm talking about. Even the Kerala model of palliative care began with few well-meaning individuals coming together, seeing what resource they have, what they can do to make a difference, and then just starting to do it instead of waiting for somebody else to come in the picture. And this was all that was required. So just like how now for all those people who are here on this platform, you can see that there is a Shiv Kumar sir in Bangalore who says there is something like this which can be done. And this is called a social capital, basically, where somebody has who is from another city is here. All of you are on the same platform. All of you are well-meaning individuals, and we want to do something about this. We want to start something off. So Vishwanath Sharma is saying that we can organize some sort of events to collect some financial assistance to the needy one. Yes. See, that's what I'm saying. Fine. Every time we have these issues come up, always people come and get stuck in funds is not there. But I want you to know money is not everything. There are people who can provide the service which the money was supposed to buy. And there are people who are in different spheres of specialties. Now Shiv Kumar sir has opened this opportunity up. I'm sure there are other people right now in this group itself who have their own strengths. Jayanta Ghosh would like to say, in Kolkata, we run a trust that looks at nutritional needs of vulnerable, marginal, older people. See, on one side, we are looking at nutritional needs for the elderly, for those in vulnerable conditions with lifelong illnesses. And here you have somebody who can support you look at the nutritional needs. If there are other people from Kolkata, they can get in touch with Jayanta ma'am and network. This is how a network is formed. So this is the live demonstration of how a network is formed. CSR funds aren't tapped at all. It is true, sir, but CSR funds definitely needs a lot of looking into. For example, there is a lot of accountability in the which needs to be. There's a lot of paperwork which needs to happen to tap in CSR funds, and there are a lot of rounds of qualifications which is needed. There is a lot of competition in that field as well, and many a times what I have seen is there are very few organizations who know how to write a proper proposal. If they want to write a proposal for a CSR fund, how to structure the proposal, how to put in a budget, how to put a framework for monitoring and evaluation and accountability. I'm sure there are people from management background as well over here who may be more knowledgeable about these things. If somebody like that can volunteer to help out such an organization, I'm sure there is a lot more CSR fund which can be tapped in. CSR means corporate social responsibility, which is a law which is there only in India. And according to this law, any corporate body who is for profit should contribute 2% of their profits for social causes. So there are organizations who are looking into environmental causes, health-related causes, disease-related causes, all kinds of things. Similarly, there are organizations which look into palliative care also, who are interested to contribute towards palliative care. So focusing on those CSRs with the help of somebody who can put together a nice proposal is something which we can look at, which needs to be looked at. So strengthening family within and create a positive environment for longevity. Yes, and Marine Man, it is true. But many a times it is possible, like I was mentioning, there is something called as caregiver fatigue. Just creating that positive environment takes up a lot of toll on the caregivers. Hence, it is always needed that we have a larger community whom we can rely on for support. So Shiv Kumar sir is offering here that there are 60 participants here and we can form a good network. There are chartered accountants who can help, and sir is also willing to help, and he has given his email ID as well. See, here we have somebody who is standing up, Mr. Mahesh Somani. He would be willing to help our CSR proposals and connections. So this is a live demonstration of how a network is formed, how a community network is formed. It's as simple as this, just few people, well-meaning individuals coming together, willing to do things. Devika, you want to add something?
Nothing. I think it was an amazing responses that I've received. So these were the discussion points, and no, can you move on to the next slide? So yeah, so as of now, since as these are the plans which you've already responded. So we do a home visit to explore more about the psychosocial issues, and then we can provide education support for the other children. We can facilitate disability pension for the patient. So that is also one important factor. We can facilitate for that. So social workers usually can help in facilitating the disability pension, guide them on how to apply for it, guide them on what are the different procedures to receive it. And then also we have a lot of government schemes that which we can help them to link with. We can check with the PHC, primary health centers, to avail diaper and medication support for the family. So these are the initial things we can do. So yes, that's all about it. Thank you. So if you have any more doubts or anything regarding this case history, you can drop a message in the chat box.
We have a few more minutes. If anybody would like to add some comments or unmute yourself and share some experiences, we would be glad to hear. Put the chat box on this side.
Thank you, Shivakumar sir. Anyone has any more doubts regarding the case history or regarding the session? Anything to add on?
So we'll wait for another minute before we close. And so this is, all right, we have a comment, need more info on pain assessment. Yes, we'll be having sessions on pain assessment as well.
Yes.
So that will be there coming up next week or the week after. We will be going into detail in each of these dimensions and seeing that how is it that we can help in such situations. Always remember that whenever you embark on doing something, have in mind that tomorrow, if you are not there to do it, how can that help continue? Or how can it be a self-sustaining mechanism? This is something which all of us should have in mind. It may be linking with government centers or other NGOs, or training somebody else to be the same as you, etc. There are so many possibilities which is there. Yes, Vishwanath Sharma sir is saying in our state of Sikkim, we have Jan Kalyan Prakosh, an initiative of the Chief Minister where we can approach there too. Yes, sir, I'm not aware of what the objectives of the initiative is. But if you feel that it is going to benefit somebody in health related suffering, definitely yes. you should explore, you should take the initiative to go and talk with the medical officer or the government official who is in charge and do awareness sessions. Even schools and colleges are good places to do awareness sessions like these, because in their homes, school and colleges are one place where hundreds or thousands of children come together. That means hundreds and thousands of families are coming together at the same place. So if you give an information in a school or a college, I'm sure a young one, especially school children, are much more enthusiastic to go back and do something about it. So suppose you inform in school that there is something like this, which needs to be, which can be taken help from for the grandparents or somebody with a disease at home or a bedridden person at home. These are ideal places where awareness sessions can be done. Okay, they especially deal with cancer and all critical illness. Understood. So Shiv Kumar sir is also grateful enough to share with us that he started a trust in his father's name. It is under process, and to help those in need. Do let us know, sir, how we can be of help. If you want to include palliative care also as part of your trust. So Anne ma'am is asking how the cases are terminated after intervention and evaluation. So this is an ongoing process. One of the forms which we have in our, is in our case sheet is we have a goals of care. What is the goals of care which can be practically done is something which we look at. So this has to be defined at the beginning itself. We should also remember that a human being's needs are never ending. It is always going to be there. So there is a line you may have to draw somewhere, that what are the issues you will address, what are the issues which you will not address, or you want to hand over to some other organization or person to address. So whenever that goal of care which you have set for your patient with the limited resource which you have or your organization has, when that is reached, that is where you draw the line. And drawing a line doesn't mean that tomorrow onwards you ask them not to come or you completely cut off contact. No, you continue follow up with that person once a month, maybe once in 2-3 months. See how they are doing, keep in touch with them, because we were not trying to do just a treatment and leave the person alone. We were trying to build a relation with the person to ensure that maybe tomorrow that person who has a lived experience may become a volunteer. We don't know. And there is always group discussions to have between people who have similar kinds of suffering. And this exchange of experiences itself is hugely empowering. So that's about that. Is there anything else which anybody would like to add? We'll wait for 30 seconds more and then we'll call it an evening.
So shall we wind up the session now? I hope. Yes. Right. So thank you so much, everyone. Thank you. And we're going to wind up the session right now. We'll see you in the next session. Thank you so much.
Thank you.
Thank you, Dr. Deepak. Thank you.
Thank you. Thank you, everyone. And please do ensure that next time onwards, you're there in a space where there is, many people message that there is no range, network issues, etc. Please try being in a space where there is range, because you know that there is a session like this. We would love to see all of you, interact with you more. Yes, sir, you have turned on, Vishwanath Sharma, sir, you want to share something? You have turned on your video.
No, sir. Just want to saying thank you.
Right. Thank you so much. Thank you, everyone. Have a good evening. Bye-bye.